Welcome to Ask MSVIA, where we answer your most common insurance questions clearly, quickly, and without the jargon. Let's get into today's topic.
Hi, thank you so much for talking to me today.
Hey, thanks for having me.
I have a quick question for you. Can you explain what prior acts coverage is in simple terms and how I should understand it?
Yeah, so prior acts coverage, you may have also heard it be called nose coverage before.
I have not.
Maybe not. So it can
Okay.
also be referred to as nose coverage in case you don't want to use jargon. But so prior acts coverage, what it does is it actually extends insurance coverage to a date prior to the actual effective date of the policy. So let's say you had been working in medicine. January 1st, 2020 is when you started seeing patients with a practice. 2024 comes around, you say, new year, new me, I'm going to start my own practice. That retroactive date, if you're picking it up for prior acts back to when you started seeing patients in January 1st of 2020, that means that this new policy, even though it's now being effective in January 24, is actually going to cover you for claims that occurred or incidents that occurred back to January 1, 2020. So it's a way of giving the insurance policy coverage of things that happened in the past prior to the actual effective date of the policy itself.
So is this included automatically in my medical malpractice insurance, or is this an add-on?
It is not necessarily included automatically. It's something that we, as an agency or any agency that you work with, needs to make sure that it is actually covered on your policy. So I think there happens to be a pitfall sometimes when people think about insurance. They're like, oh, I got insurance, that's all it is, because we think in terms of our home and auto. Well, those are occurrence policies, not claims-made policies, which is the dominant type of policy for a malpractice insurance policy. And so when it comes to a claims-made policy, if you had a retroactive date and you had been seeing patients, you need to let your agent, whomever you're working with, know that we need to pick up that prior acts.
Okay. So if I am running a practice, for example, I'm a practice manager and we hire a new physician, do I have to cover their past work as their new employer?
You don't necessarily have to. It comes down to how your agreement is with the new hire. However, if they're coming from another practice that had prior acts coverage for them, they can either tail out. But if you don't know if they've tailed out, it's a good idea to actually go ahead and pick up that prior acts coverage when they join your practice.
Can you tell us what tailed out is?
Yeah, so we had the nose. We're all about anatomy here. So we had nose, and then there's also a tail, so an extended reporting endorsement if you use the jargon variation of it.
Okay.
So a tail, what that does is, let's say you had your policy from January 1, 2020 to January 1, 2024, and then canceled it. Well, your policy will only react to claims while the policy is actually active.
Okay.
So you need to purchase what's called a tail or an extended reporting endorsement, and that extends coverage from that 2020 to 2024 period.
Okay.
Or if you're joining a new practice, you can say, hey, I'm going to join your practice. I'm going to be put onto your insurance. I need the retroactive date of January 1, 2020, and that's the prior acts. So there's two ways to sort of handle that. You can either tail out and start fresh on a new policy, or they can pick up prior acts when you join the new practice, and that's going to just keep that coverage extending just with a new insurer.
Okay. What is the benefit to a practice just hiring a physician to take that over, prior acts for them?
Well, one thing is that you know that any kind of prior patients that are being seen are going to be covered.
Okay.
So for instance, if they have a claim that comes in prior to them joining your practice, they're not going to be hit with a claim that's uninsured. So that can be beneficial.
Okay.
And then in addition, I think that's probably the biggest one. Outside of that, it's just sort of making sure you have full control of their policy and there's no gaps. So this physician's not in a bad position when they're joining your practice, setting them up for success.
Okay. And then what should we be asking a new physician about their previous medical malpractice coverage?
So a big one is, do you have a copy of it? A lot of the times people try to sort of just guesstimate or give you little tidbits here and there. Honestly, if you're somebody that you worked in a practice and they gave you a copy of your declarations page, which is the informational pages, that's a lot of the times the easiest place to start, because that's going to tell you, did they have an occurrence policy and they didn't need any kind of prior acts coverage? Or did they have a claims made policy, in which case it'll have in bold retroactive date. And retroactive date is what you need to match up.
Okay. Can prior acts coverage help fill that gap, or is tail coverage the better option?
that's dependent as well. So tail coverage is much more expensive.
Okay.
So tail coverage can run anywhere between 180 to 210% of what the policy premium was.
Wow.
So let's say, for instance, you're paying $10,000 a year, and then you tail out, it could be anywhere from $20,000 to $22,000. Because what they're doing is they're saying, okay, it's a whole new policy by itself. This policy, all it does is react to claims that happen during this time frame from retroactive date to cancellation. However, if you have a policy that's going to pick up the retroactive date, then you can go ahead and it's cheaper, first and foremost,
Okay.
because you're not actually tailing it out. So that new insurer is actually just picking up all of that prior coverage that you had or prior exposure.
Okay. Okay, thank you. And then what are some common mistakes practices make when it comes to prior acts coverage?
The biggest one is assuming that they didn't have a prior acts coverage or prior acts coverage on their policy. They didn't have a retroactive date. They didn't have a claims made policy.
Mm-hmm.
Biggest thing is just making sure that there's not a gap in insurance. Because let's say somebody, I'm just going to keep using the same dates, January 1 of 2020, and then they're joining you 2024. Well, if they didn't either tail out or you don't extend coverage, like I said before, they're going to be personally liable. There's no insurance coverage for that whole 4 years
Wow.
of seeing patients.
Okay.
And depending on where you are in your career, that could be a lot of patients, could be a little patients. Regardless, it's all exposure that's not insured.
Okay.
So that's a huge pitfall. It's probably the biggest one, making sure that you actually do match those things up because you don't want a gap.
Mm-hmm. Okay. So last question. If a practice is unsure about their coverage, what's the first step that they should take?
The first step that they should take is talk to a professional and then give that professional what they have. So, if they're coming to me, for instance, and I'm helping them set up a policy for their own new practice, one of the first questions we're going to ask is, did you have a claims made policy before? Do you know the difference between claims made and occurrence? And if they don't know the answer to that, the next thing that we would probably say is, can you send us your declarations page so we can actually be sure that you have, what you need?
Yeah.
Because it's very easy for us just because we see them every day. However, a lot of the times when you're dealing with any kind of insurance or financial vehicle, unless you work in it or have been personally victimized by it in the past, you're probably not going to know a lot about it.
Yeah.
So, give all of the information that you have, any info that you possibly can to the agent or broker or carrier that you're working with when you're establishing your new coverage. Because the story that you had is really the story that we want to make sure is keep being told.
Okay, perfect. Well, thank you so much for talking with me today, Eddie Schneider.
Hey, well, thank you so much for having me.
If you want to learn more about MSVIA and from Eddie, please visit www.msvia.org.
Thank you so much for having me.
Thanks for tuning in to Ask MSVIA. For more resources or to speak with our team, visit msvia.org. See you next time.